Ladies and gentlemen, I believe that we all want to be beautiful, and I believe that we all want to be healthy as well. And if we want to be healthy, then we have to protect ourselves from everything that makes us sick, at least to the extent that we can. And cancer is one of the diseases that leads to most of death and disease in the world right now. For this reason, it is important to see what we can do in order to prevent cancer, or to put it plainly, to protect ourselves from cancer. In this frame, I'm very happy to present you the European Code Against Cancer, which is a set of 12 instructions or ways to reduce our cancer risk. My name is Christos Tsagkaris. I'm a medical doctor and a youth ambassador of the European Code Against Cancer. And today I'm happy to be part of the delegation of LAMSA Lebanon in the Beauty and Wellbeing Forum of Beirut. We talked about cancer, a disease, but we are in a beauty and well-being forum. Should we stop right now? Is really disease and health something that we can discuss together? It is, or at least it's not that simple to take disease out of health. Health, is not just the absence of disease. It is indeed a state of complete physical, mental, and social well-being. And this is exactly how the World Health Organization has defined health. For this reason, when we talked about beauty and well-being, we should keep health in mind, and we should do everything to ensure that health prevails over disease. And speaking about the disease, we already mentioned cancer. What is cancer? In the past, it used to be a word to describe just an animal in the sea. Later, it became a zodiac sign, something that people use to predict their futures. And now, for most of us, it's a synonym to a disease, a medical term, a biological phenomenon. In reality, all of these are true because cancer is a biological phenomenon, something that concerns living organisms, including human, and it has the potential to affect and, in most cases, destroy our future. For this reason, we should keep in mind that we have options to take action against that. We talked about prediction. We cannot predict everything. We cannot say the future for every one of us. But scientific studies have already shown that up to 50% of cancer cases can be prevented. So almost half of all deaths due to cancer in Europe, where these studies were done, can be avoided. And the way to achieve this is to follow the recommendations of the European Code Against Cancer, which is an evidence-based, so a scientific tool created by the European Commission and the Cancer Agency of the World Health Organization in order to support people in the broader European region of the WHO, but also all over the world in their effort to reduce their cancer risk. And speaking of 12 instructions, let's start with them. The first instruction is smoking. We should quit smoking. Tobacco is in its classical conventional form of cigarettes, but also in its newest form of vaping devices, is a well-known carcinogenic. This means that this is a substance that can cause cancer. And it cannot cause cancer only to us in case we smoke. It can also cause cancer to people around us, people that are in the same working space with us, people that are in the same home with us. Essentially, our children, our parents, our brothers and sisters. And the next step, after we quit smoking and we ensure that everybody around us is also protected from smoking, is to make sure that we lose weight. There are many ways in which extra weight can increase our cancer risk. It's not something that we can explain in 5 minutes, but there are many studies that have shown that as long as we maintain a healthy body weight, then we have way less risk of getting cancer. And even if we get, then we can stand better during the treatment. And maintaining a healthy weight is not something that comes on its own. It has some requirements. One of these requirements is physical activity, so doing sports. This is very important, and it's something that rewards us not only with regard to preventing cancer, but also with regard to maintaining good cardiovascular health, good metabolic health, and also maintaining healthy and strong muscles and bones. And together with physical activity, we have health nutrition. We cannot really remain fit even if we cycle all the day if we don't also eat healthy. So with all this, we maintain a healthy way of living that enables us to have a stable body weight. And what else? What else should we think about? What else are we doing? Many of us are consuming alcohol. Alcohol, so wine, beer, spirits, are things that we usually combine with a party, with a festivity, with birthday, with celebrating. But in reality, it has also been shown that in the same way with tobacco, in the same way with cigarette, a glass of wine or a bottle of beer can increase our cancer risk. For this reason, the consumption of alcohol should be avoided, and if we cannot avoid it, we should at least minimize it as much as possible. And I believe that we talked a lot about what we can eat and how can we behave. And we should not forget that it's not only about us, it's also about where we live. Um, I come from Greece. Most of you should come from Lebanon. We all come from countries that are widely exposed to the sun. This is something very good and healthy, but everything can be harmful when it comes in excess. So when we are exposed to the sun for long hours, then we have the risk of getting skin cancer because there is the light that we see and there is also the light that we cannot see. The sun also sends to the earth radiation that can irritate our skin, burn down our skin, and destroy it in a way that cancer is produced in our skin. And I talked about the light that we cannot see, and there are many more things that we cannot see. One of them is pollutants, and another one is radiation. We all live, or most of us live, in big cities or close to big cities. There are factories, there is traffic, and all of these contribute to polluting the environment, making the environment less clean. And an environment that is not clean is not only an ugly environment, it's also an environment that puts us and every other animal on the planet at risk. And one of the risks that we get through this is cancer. The same applies, of course, to any source of radiation. This is the reason that when you come to the hospital, you will see that we doctors usually wear special clothing when we are close to radiological devices or other material that create radiation. And if we do that, then imagine how much careful we should be with any source of radiation in our environment. And speaking about hospitals, there are some things that we still need to take care with regard to our relationship with our doctor and the medications that we might need to take or that we are expected to take in different stages of our life. For those of you who are women and who had the pleasure of having child, breastfeeding is important because it has been shown that it reduces the risk of breast cancer. At the same time, for the women who are relatively older and are closer to the so-called menopause, there are many people and who suggest or consider taking specific medication in order to delay menopause. This is something that can be, of course, necessary and should be discussed with a physician, but it should only be taken after discussed with your doctor because it also may increase the risk of you having cancer. And now, going back to the entire population, we have vaccines. It's a bitter, probably, experience that we had as children. We went to our doctor and he held a big needle and he vaccinated us. And it's something that most of us also remember from the COVID-19 pandemic, when we all had to take vaccines in order to reduce the risk of infection. And we all think that vaccines are only about infections, but vaccines are also about cancer, especially the vaccine for HPV, the human papilloma virus, and the vaccine for hepatitis viruses, viruses that can respectively cause cancer in the liver and in the genitals. And this is something that applies to both men and women and should be sought. And at the end of the day, preventing cancer is not only about vaccines. Many of you who have probably heard about women having mammographies after the age of 40 years old. Some of you have probably also heard about people having endoscopies of their gastrointestinal system, so of their bowel, after the age of 45 or 50. Many of you probably have also had the so-called pap smear, which is a test about cervical cancer. All of these and many other tests have been shown capable enough to detect cancer early enough to treat it without having a big risk for our lives. So it's something that you should discuss with your doctor. There is no one rule for everybody. There are general rules, but we always adapt these rules depending on our age, our habits, depending on other people who had cancer in our families. And combining all this, if we do all this, then we have good chances of reducing our cancer risk by up to 50%. And this is the so-called prevention. Prevention is acting now to avoid something bad that would happen in the future. And prevention can go very far. We have the prevention that happens to individuals like you and me. So for you and for me, it is possible either to avoid disease entirely. This happens when, for instance, I don't smoke and I don't drink alcohol. In this case, I reduce the risk of getting any cancer caused by tobacco and by alcohol. There is, of course, the possibility of detecting and treating disease early. So this would happen in case I had, for instance, an endoscopy, a colonoscopy, and I would find a polyp, so a lesion, a problem, a small structure that has the potential to become cancer in my bowel, and I would remove it before it evolves into cancer. And of course, prevention is also about making sure that I will not get the same disease again or a different disease after having a disease. So you already know, or I hope that you have not experienced that, but people who had cancer get tested for months and years after their diagnosis and even treatment to make sure that they will not have a second time of this disease. So prevention is something that applies to all these steps. We hope that with the rules that we explained, we can either avoid the disease entirely or detect it and treat it early. But in any case, this is something that we should keep in mind for the whole spectrum of the disease. And this is about you and me as individuals. But you and me are also a community. And as a community, we also have the right and the obligation to take care of the so-called primordial prevention. And this is about making our home and environment healthy. So you and I, as people, can decide that we will drink less or we will not drink, that we will eat healthy, that we will exercise, that we will get tested, and so on and so forth. But we cannot really remove all the pollutants from the rivers or the seas around us. We cannot, on our own capacity, make the air cleaner. But if we work together and if we reach out to our physicians, our scientists, our civil society, and the people who rule over us, we can also demand that we live in such an environment, in such cities and neighborhoods that reduce and minimize our cancer risk. And where do we start from? We should learn. There are plenty of material outside. And there is the European Code Against Cancer, a resource that you can also go into and learn more about the specific instructions. We should ask. If you are unsure, reach out to your doctors. And we should take decisions to change our lives and our behaviors. For instance, to eat healthier, to exercise more, to drink and smoke less, and ideally not at all. And leaving this presentation, what should you remember? What should we all remember? First of all, prevention is health. And if we are healthy, then we can be beautiful. This is what this forum is about. In the same way, we care about being beautiful, finding nice clothes, nice beauty products, and so on. We should also care about being healthy. Otherwise, we cannot be beautiful, or we cannot be as beautiful as we can be. And I talked a lot about we. We can do a lot. We can follow these steps to reduce our cancer risk, but we can do also together. We should work together, we should learn together, we should ask together, and we should demand together in order to achieve health for us and for everybody in our community. Are we done with the presentation? Yes, we are, but you are most welcome to read more about the European Code Against Cancer, as well as about the work that LAMSA is doing in order to tackle substance use, so alcohol, drugs, and tobacco use. And remember, if you have questions, reach out to us. We will be happy to help with general questions. And if you have personal questions about your health, make sure to reach out to your doctor. Thank you very much for your attention. Stay healthy.